is Professor Nariyoshi Shinomi. Professor Nariyoshi Shinomi is a president of National Defense Medical College. He was a former director of NDMC Research Institute, also professor of the Department of Integrative Physiology and Bio-Nanomedicine. His specialty includes microbiology and immunology, molecular oncology, diving medicine, and bioethics. And today, he will be talking about current situation of COVID-19 in Japan, because we'll be very delighted to listen the current situation. And we all know that Japan is one of the countries who handled it very successfully. And we would like to learn lessons from Japan. So I would now invite Professor Nariyoshi Shinomi. Please, the floor is yours. Thank you.
Thank you very much. Can you hear me?
Yes.
Okay, thank you very much, Mr. Chairman, Professor Muhammad Ali. It's my great honor to have this chance to give my talk today. I would like to express my sincere thanks to especially Professor Zabsa Shinwari, who provided me this nice opportunity, and also all the members of the organizing committee of this meeting. So I'm going to talk about current situation of COVID-19 in Japan. And here I'd like to share my slides. Can you show my, can you see my slides? Okay.
Yes, please. Yes.
Okay. So I'd like to start my presentation. And this slide shows the outbreak trends of COVID-19 in Japan. The data represent the trend of number of PCR positive cases. We have experienced 4 waves, 1, 2, 3, and 4, of infection since last year. The first one was in April last year, and the second one was in July to August. The third one showed a peak in January this year, and we are just in the middle of the 4th wave. As you can see, the magnitude of infection is becoming bigger and bigger wave by wave. According to the analysis by the specialists in the field of statistical epidemiology, the 4th wave will soon overtake the peak of the 3rd wave. So we really need to pay attention to the situation in the near future. This slide shows the trend in the number of severe cases in Japan. There is about 2-week delay in each wave as compared to that of PCR positive cases. That means disease occurs just 2 weeks after the onset. But the tendency is quite similar to the previous slide. Red arrows from 1 to 3 indicate the period of the state of emergency that was called by the Japanese government. That was announced by the Japanese government. We have already experienced 3 times. Under the state of emergency, people's movement was restricted, and thus there was an effect to suppress the disease transmission. Green lines shows the period of Go To Travel campaign, which was introduced by the Japanese government after the first wave. And this was because Japanese government wants to stimulate the Japanese economy. The Japanese government implemented other go-to campaigns, such as Go To Eat and Go To Event or something like that. But some people criticized that these campaigns might have exacerbated the 2nd and 3rd waves of infection. This slide shows typical clinical course of COVID-19. We often use this slide to explain what the disease is like. There are a lot of asymptomatic infected people, but I'm not going to talk about it in detail here. Generally, the disease begins with common cold-like symptoms, impaired sense of smell or taste. 80% of infected people get better without any treatment. However, 20% become worse in 1 week to 10 days, showing dyspnea, cough, sputum. Patients with moderate disease here need to be hospitalized. 5% go to severe disease and need intensive care, like ICU management or external blood exchange. The death rate is about 2 to 3% in total. So this slide shows COVID-19 death cases by age. As you can see here, most cases are more than 60 years old here. This is why young people generally do not have sense of crisis and do not want to obey the government restrictions and feel dissatisfied with the government policies for restricting activities. Currently, more than 10,000 people have already died from this disease in Japan. So this slide shows the number of secondary infection originated from one patient based on the cluster analysis, which was performed in February last year, or almost 1 year ago. Looking at the reproduction number, our note, COVID-19 showed the value of 2 to 2.5. But this is the average number. Actually, the analysis of 110 cases showed that 80% of infected people did not spread the disease to anyone. Here, 0, not anyone. However, as indicated, 2 arrows here and here in the graph, there were super spreading events like houseboat and sports gym cases. Detailed situation analysis revealed that crowded places, close contact settings, and confined and enclosed spaces, all 3 conditions had contributed to the occurrence of these events. That's why the slogan, "Avoid the 3 C's," was produced. Okay. As you know, the virus was originated from Wuhan, China. According to the virus genome analysis, the virus brought from Wuhan, China in Japan at the very beginning of the last year. But the method of cluster analysis and the containment infection control resulted in success. So the Wuhan virus was completely disappeared from Japan, eradicated in 1 month. Instead, from March last year, viruses imported from European countries spread and they become the dominant types for clusters of domestic cases in Japan thereafter. After the first round of state of emergency, almost all clusters were suppressed. Nevertheless, the chain of infection continued underground and suddenly appeared as a 6-base mutation virus without obvious clusters here. After that, the mainstream of infection was taken over by this virus. So that means a bottleneck effect. Only this virus spread thereafter. Okay. This slide shows genome analysis in Japan last October. After July 2020, all viruses were divided in two common genome type groups. So thus, genome analysis clearly shows how the disease were transmitted. Okay, let me talk about the situation in Japan this year. To suppress the third wave, the state of emergency was announced from January 7th to March 21st this year. There are 5 requested actions. First, infection preventing measures at the restaurants. And the second one was countermeasures for variant viruses, like strengthening the quarantine, investing in more samples, and collaboration with private sectors, etc. And the third one was strengthen the PCR testing system. And the fourth, promote vaccine inoculation. And rapid inoculation is really need for healthcare workers. And provision of vaccine information about effectiveness and safety was a very important issues to give the information to the public. And the fifth one was establish smooth medical care provision system. So we need to take care of many patients with moderate to severe disease. So our hospitalization is really important. Smooth hospitalization is really important. So this state of emergency had some effect to suppress the disease transmission. But soon after restrictions under the state of emergency was removed, the number of infected people increased rapidly. So we really need to keep those issues. And this slide shows the vaccine dose administered to the people. And despite the policy of promoting vaccination, Japan's vaccination coverage rate has still remained a low value, as you can see here in this map, and compared to the European and American countries. And this is mainly because the delay in vaccine the import, because Japan doesn't have the original vaccine, so we need to import from other countries. And this figure shows the number of daily infection cases of May 1st this year. So just the beginning of this month. The situation is serious in big cities, indicated green arrows, and especially in Osaka here and in Tokyo here, the situation is very serious. The Osaka is affected by the viruses called mutant type N501Y virus, which previously spread in England and has about 1.5 times larger infectivity than the existing virus. The mutant type is rapidly spreading in Osaka, and previous genotype has been replaced by this type virus. This situation in Tokyo, the situation in Tokyo is also rapidly changing. This is February, March, and April. So as you can see here, N501Y indicated by red ink, which has some resistance to, sorry, N501 has already become the dominant type here, more than 50%, just in 1 month compared to the March. Also, E484K type indicates by the brown, which has some resistance to current vaccination, is increasing. So it's very important to stop the spread of this type of infection by vaccination as early as possible. Otherwise, the situation is considered to become devastating. Again, this is the same slide that's shown before. which show the trends of the number of severe cases in our country. At the moment, we are under the call of the state of emergency. The period is from April 25th to May 11th, and effective actions must be taken steadily. So currently, the following items are being carried out. 1, request to refrain from business, mainly restaurants and bars or very big facilities where people get together. And the second is suppress the people's movement. And the third one is suppress clusters at facilities, because many aged people are taking care of their facilities. So we really don't want to make big clusters. And the fourth one, provide sufficient medical cares. This is also important to take care of severe patients. And the fifth, the others, like such as oversight of restaurant and the facilities where people may get together. But this is the third time of the state of emergency. And some people say, we have already got used to it, and the effect seems to be limited. Therefore, additional countermeasures should be taken into account sooner or later, I think. Finally, the problems to be solved are listed here. 1, mutant viruses are rapidly becoming dominant, so we really need to suppress the outbreak. And 2, in addition to the vaccination programs, in each city and the villages, large-scale mass vaccination programs are going on. We at the National Defense Medical College are going to support them. The third one, the government needs to build robust care support system for patients with mild to severe diseases. And the 4, smoother provision of PCR detection services is still the matter to be solved. And the 5th, the Japanese government may need to extend the period of the state of emergency, because many people don't think we cannot finish this big wave within 10 days or so. And the 6th, also we need to discuss the Tokyo Olympic and Paralympic Games, whether we can hold them safely in such situation. Thank you very much for your attention.
Dr.
Thank you very much, Professor.
Dr. Mohammed, 30 seconds just to say a few housekeeping announcement. May I ask all the participants, registered participants, to send your questions through chat box that will be communicated to the moderator, and he will ask the presenter at the end to, or after 2-3 presenter, whenever he would like to. So may I request you to kindly send your question in the chat box, and we will communicate it to the moderator